Hello, everyone. Welcome back to the Mammography Registry Review. I do have a lot of videos like this out, but in today's video, it's going to be 20 must-know questions and answers that you must know for your registry. This is for the BI-RADS score only because if you're new to my channel, I have over 30 videos out now that you can study from. But specifically for this video, I am tutoring someone for Mammo. So shout out to you, Anna, for asking me if I could make this video about BI-RADS score. So I do have more type of question like this, but they are really found in like my mock exam videos. But other than that, could you all please like, share, and subscribe to the videos because this is what motivates me to keep making more videos. I enjoy doing this, so I just look forward to the likes and the comments so that it could just push me to make more videos like this. All right, so before I get into the question, I just want to give like a quick shout out to the ladies that have passed their registry. I wanted to at first I was going to put this information at the end of the video because I know you all just want to get to the question, you all trying to study, but I thought that this would motivate you all to just really pay attention to my videos, especially all of my videos. You can find them in my Mammography Registry Review playlist. If you click on like my YouTube channel, you can find it in my playlist for Mammography Registry Review. It has about 30 to 40 videos that I've already have made. So anyway, these ladies use my videos to pass their registry. So shout out to Cassandra. She passed her test in this month, October 2025. Happy Breast Cancer Awareness Month. And then I have more people who passed their registry in September 2025. They all use my videos to help them prepare because I always like the ones I know who use my videos, like I know for a fact they was using my videos because they will leave comments and they will ask me to either make new videos of this or clarify something on my other videos. And then this is for August of 2025. So I will always see comments um, about could you make another video like this or could you do that? But up until this point, I think I have a lot of videos out that I really need to make for Mammo, but I can always make more and I can always update the list. So another shout out to these ladies. Congratulations. Also shout out to Veronica. Um, I remember her, like I remember everyone, but it's like certain people that kept seeing in the comments, they will always ask me questions or they will always suggest new videos. And then Veronica, she came back and left a donation after she passed her registry. So I'm very appreciative of that. Very appreciative of any likes I get, any comments I get. Also for July, shout out to these ladies who passed their registry in July. Congratulations. So they all they just ran through my playlist and they would just binge watching my videos. I've had people tell me that they watched it in their car on the way to work. They watch it while they're in the line picking up their kids. They watch it whenever they're washing dishes or something. So I just wanted to put this in the beginning so you all can know, hey, let me use her videos with my other resources. You can just combine them, or I don't know, do what they did. They just went through all of my videos because each video has new things in there. So it's going to be new information that you are going to learn in all of my videos, like this video right here. There are all new questions and answers. So we'll get into the Q&A. I just want to put that just to inspire and motivate someone, especially if you're feeling nervous. So if you're new to my videos, I am going to read the question, the answer choices, and then I give you like some seconds to think about the answer. If you feel like I'm going too fast or too slow, you can always pause or rewind the video. Write down the questions that you missed or got wrong so that you can go back and study them. And so the reason why I do read the video out is because I make all these questions by myself. Like all of the questions that I have on my page in these series, these are my own questions that I make up. So I don't want anyone like taking my work from me. So I always just read out the question. I always put something in my videos just so people can see, oh, that's something that she made. So other than that, if anything on the screen bothers you, you can always cover it up with a sticky note. If the audio bothers you, you can always just turn it down or mute it. But this is just how I do, just so I can know that this is my pretty much content. But other than that, enough rambling. I just want to get that out at the beginning because a lot of people are new to my channel daily. So I just like for people to know what to expect. So other than that, here we go, and good luck on your mammography registry exam. Question 1. Which BI-RADS score means incomplete? A, 0, B, 1, C, 2, D, 3. All right, the correct answer is A, 0. A BI-RADS score 0 means the study is incomplete. Additional imaging evaluation is required or comparison to a previous mammogram, breast ultrasound, breast MRIs, etc. is required before the final result is given. This score means that a possible abnormality may have been found by the radiologist, but it is unclear until magnification views are done, spot compression, breast ultrasound, breast MRI, etc. is completed to determine this. That's why if a patient has already had their previous mammogram somewhere else, it's important to get the priors because if this if this area was already seen and aspirated or biopsied, at least that report and those images would show this versus this is, versus this may possibly being something new but have already been biopsied. Whenever the prior images come back, if the patient was like, no, I know for a fact this is the same area, um, those prior images will come in and the radiologist probably can make like an addendum to their report to say, okay, the first report need additional imaging or prior records, but they can do like an addendum and say, okay, we received the prior records and, do other things with the report because I've seen like addendums being done before. So that's the answer for that one. Question 2. Which BI-RADS score means probably benign? Sorry if I stumble on my words. I'm literally recording this at 7 o'clock in the morning, so I'm still trying to wake up. A, 0, B, 1, C, 2, D, 3. All right, the correct answer is D3. A BI-RADS score 3 would indicate that a finding is probably benign. A short time follow-up is recommended. The patient may have to follow up within 3 to 6 months. Question 3. Which BI-RADS score would indicate this pathology that is shown in this image? A1, B2, C3, D4. All right, the correct answer is B2. So this pathology that is shown in the image is a breast cyst and would be a BI-RADS score 2, which is a benign non-cancerous finding. So I want to throw out a disclaimer because I am not a radiologist. So this image was found online, and when I found it, the the site said that this was a breast cyst. So um, we'll just pretend that it is. If it isn't, because like I'm saying, even if I think I know what I'm looking at, I'm not a radiologist. This is just for educational purpose only. But I do know that this does not look like a cancer because of how round it is. So cysts are normally like round. So anyway, I just wanted to throw that out there that this is just for educational purposes only. I'm not a radiologist. Question 4. A BI-RADS score of 5 would indicate A, benign, B, incomplete, C, highly suggestive of malignancy, D, known biopsy proven malignancy. All right, the correct answer is C, highly suggestive of malignancy. So for this score, a biopsy is strongly recommended with this finding because it looks like a cancer. Question 5. Which BI-RADS score would a fibroadenoma fall under? A, 2, B, 4, C, 5, D, 6. All right, the correct answer is A, 2. So a BI-RADS score of 2 would indicate a benign, non-cancerous finding. Since a fibroadenoma tumor is a non-cancerous or benign tumor, it will fall under score 2. All right, so if you are finding this video helpful, could you please like, share, subscribe to the video so that I can make more videos for you all. And thank you so much. Question 6. This is a situational question. A suspicious abnormality was found and the radiologist recommended for the patient to have a biopsy. Which BI-RADS score would this be? A, 2, B, 3, C, 4, D, 5. All right, the correct answer is C, 4. So if you all can like leave me a comment down below under this video, let me know how you all are doing on the BI-RADS score on this quiz. Like, are you getting them all right? Are you missing a lot? Because if you are missing a lot, you need to like keep rewatching the video so that you can understand it. And then I've also made a video about this already where I put the BI-RADS score in the video and have like a chart of what goes to what. So you'll just have to like review that or just keep rewatching this video. Question 7. This is another situational question. A breast cancer has been confirmed on a breast MRI, mammogram, breast ultrasound scan, and the breast biopsy results. Which BI-RADS score is this? A, 3, B, 4, C, 5, D, 6. All right, the correct answer is D6. So, number 6 or score 6 would indicate that it is proven that it is a cancer. Through all of the tests and the final biopsy results prove that it is a cancer. Question 8. This is another situational question. A finding was found on a mammogram image. These findings does not look like cancer, but could probably be cancer. Which BI-RADS score is this? A2, B3, C4, D6. All right, the correct answer is 4. So a BI-RADS score, which is answer C, a BI-RADS score 4 means that there is a suspicious abnormality. These findings do not look like cancer, but it could be a cancer. A biopsy is recommended by the radiologist. Um, and another thing I forgot to add, if the BI-RADS score, like if you are one of the ones who are missing a lot of questions about this quiz, the easiest way you can know which number goes to what is first you need to understand the scores. And then whenever you see the answer choices, you can say, oh, BI-RADS score 0. I know for a fact that's incomplete. BI-RADS score 1, that's normal. That's a negative scan or test. So that's how you can start determining, okay, so I know BI-RADS score 6 is a cancer. So you can just work your way like that and go like back and forth to get the answer. Question 9. A negative result would indicate a BI-RADS score of A0, B1, C2, D3. All right, the correct answer is B1. A BI-RADS score 1 indicates a negative result, which means that the result is normal. Question 10. A BI-RADS score 1 would indicate which kind of test result. So pretty much if you was paying attention to the last question, you will get this answer. A, benign. B, highly suspicious. C, probably benign. D, normal. Right, the correct answer is D, normal. A BI-RADS score 1 would indicate a normal test result. This means that there are no masses, no lumps, no suspicious calcifications, or other abnormalities that were found. Question 11. This is another situational question. A patient must return back for a diagnostic mammogram. Which BI-RADS score would this fall under? A0, B1, C2, D3. Okay, the correct answer is A0. A BI-RADS score 0 means the study is incomplete. Additional imaging evaluation is required or comparison to a previous mammogram, breast ultrasound, breast MRI scans, etc. is required before the final result is given. This score means that a possible abnormality may have been found by the radiologist, but it is unclear until magnification views are done, spot compression, breast ultrasound, breast MRI, etc. is completed to determine this. So this is pretty much passage, the paragraph I read at the beginning of the video about the BI-RADS score 0. Question 12. This is another situational question. Benign calcifications were found on the mammogram. Which BI-RADS score would this fall under? A, 0, B, 1, C, 2, D, 3. All right, the correct answer is C2. A BI-RADS score 2 would indicate a benign finding. So if the calcifications are benign or appear to be benign, like the macro calcifications, that will fall under 2. Question 13. The radiologist recommend a 3 to 6 months follow-up for a patient. Which BI-RADS score would this fall under? A, 1, B, 3, C, 4, D, 5. Right, the correct answer is B3. A BI-RADS score 3 would indicate a probably benign finding. So the radiologist typically they would recommend a short time or short-term follow-up, and this is normally between 3 to 6 months. Question 14. Which BI-RADS score would microcalcifications fall under? A2, B3, C4, D5. Right, the correct answer is C4. So microcalcifications would indicate a BI-RADS score of 4. This means that there is a suspicious abnormality. Microcalcification could be suspicious for breast cancer, but a stereotactic biopsy would help to determine this result. Y'all, sorry if you all hear some noise in the background. This is a Saturday morning. What day is this? I think this is October the 11th, 2025. So I'm recording on a Saturday morning at 7 o'clock in the morning. So if you hear any background noise, um, I apologize. Someone is out there mowing and doing yard work. And then also I'm talking low because my child is still sleeping. Like there's no school, so my child, is still sleeping in a little bit. So anyway, um, just in case you hear any noise in the background. Question 15. A BI-RADS score of 5 would indicate A, highly suggestive of malignancy, B, known biopsy proven malignancy, C, probably benign finding, D, suspicious abnormality. All right, the correct answer is A, highly suggestive of malignancy. So for this finding, a biopsy is highly recommended. This is pretty much the finding before that is confirmed that the patient does have that cancer. All right, so if you all do not mind, leave a comment down below under the video and let me know when you all are planning on taking your registry exam. How long do you plan on studying for? I do have a video where I go over how to get organized and prepared to pass your mammo registry exam. That could be found in the playlist that I'm going to link at the end. So feel free to check it out. It gives you tips and tricks on how to pass your test, how to study for it, what you need on test date, what you need to do the day before. So I think it's a pretty cool video. It will help you get more organized. All right, so back to the video. Question 16. A BI-RADS score of 3 would indicate A, benign, B, known biopsy proven malignancy, C, probably benign finding. D, suspicious abnormality. All right, the correct answer is C, probably benign finding. A BI-RADS score of 3 would indicate a probably benign finding. A 3 to 6 month short-term follow-up is recommended. We're almost done because it's just 20 questions in this video. If you need more studying, I have videos that's 20 questions, 30 questions, 50 questions, even 100 questions. So, and then I have review lesson videos as well. So question 17, which BI-RADS score would macro classifications fall under? A1, B2, C3, D4. Sorry, that's a plane flying over. Plane. All right, the correct answer is B2. So macro classifications is a benign finding, so that's why it will fall under the BI-RADS score 2. So for this, a follow-up is typically not required. Question 18. Which BI-RADS score would this pathology fall under if this was diagnosed as a breast cancer? Like I was saying, disclaimer, I'm not a radiologist. This image was found on the internet, and the person who put it on there states that this is a breast cancer. This is for educational purposes only. I'm not a radiologist to let you all know if it is or if it isn't, but we are going to pretend that this is a breast cancer. So if it was a breast cancer and was diagnosed as that, which score will it fall under? A3, B4, C5, D6. All right, the correct answer is D6. So a BI-RADS score 6 is a known biopsy that is proven a malignancy. So I just wanted to throw something out real quick because we're all probably women watching this video, so I can discuss this because it probably shouldn't be any guys watching this. I don't think men or guys um are doing or working as a mammo tech now. But long story short, the reason why I throw out these disclaimers like this is because when we get up in a certain level, like 20, 30 years of experience, we start thinking that we know everything as techs, which we probably do because we have worked with these different radiologists, we have gained experience and knowledge, and we kind of know, okay, like when I look at because I work at CT too, so if I'm looking at a CT image and it's something found on a kidney, most of the time I know that's a kidney cyst. Or if I see like white things found on the CT image, I know that there's kidney stones. If I see like, because I work in breast ultrasound too, I work in different modalities. So when I'm doing breast ultrasound, I know it's a cyst, based off my experience. But one day I had fibroids and I did a video talking about how I got rid of it. One day I had fibroids very bad and I went in for a scan and I went to a clinic first and the guy was like, oh, he didn't know I worked in radiology. He was like, oh, I've been doing this for 30 some years. This looks like PCOS. You have PCOS. So I'm like I never told him that I worked in radiology. I'm like, number one, they teach us not to tell patients their results or anything. So of course, this is something new to me, and he's telling me that he has 30 years of experience. So I'm like home worried about, okay, what medication I have to take? How do I treat this? I've heard about people having this condition, but how am I going to treat this now? You know, come to find out, I had to go to the ER for something because at the time, I didn't know it was a fibroids causing all of the problems that I had with it. If you have fibroids, then you know what I'm talking about. If you don't have fibroids, if I can remember, I'm going to link the video at the end so that you can hear my story about fibroids. If I remember, you don't have to check it out. It's not for the Mammo registry, but if you're just curious on the different type of videos that I have. But anyway, I know I'm dragging this out. So I went to the ER because like my symptoms was just getting worse, and come to find out, I never had PCOS. Let me knock on wood. Thank you. Never had that. Um, it was fibroids that was causing my symptoms. So that's why I'm just throwing it out here. This is for educational purposes only. This is on the internet that I'm finding. They have it labeled at this and that. Even if I know what or think I know what I'm looking at, I'm not a radiologist and I don't have that background to tell you all if it is or if it ain't. So that's why I'm saying if it is good, they got the image right. But I'm just saying we are going to pretend that this would be a breast cancer. So I hope you all enjoyed this quick story. Question 19. A suspicious abnormality will fall under which BI-RADS score? A 3, B 4, C 5, D 6. All right, the correct answer is B 4. A biopsy would be recommended and considered for this score. Question 20. This is the last question. A non-cancerous finding will fall under which BI-RADS score? A1, B2, C3, D4. All right, the correct answer is B2. A non-cancerous finding is considered benign and will fall under a BI-RADS score 2. So, anyway, that's it for this video. If you are watching this video and you come across this part of the video, feel free to comment below what city, state, you don't even have to put the city if you don't want to. I meant to say state. What state or country that you're watching from. This is just something fun I like to do on my channel. So thank you all for commenting. I have people watching from everywhere from California, Houston, Georgia, Florida, Maryland, Arizona, Connecticut. And then I have more people watching from Ohio, Florida, Saudi Arabia. That's the first comment and only comment I've gotten that was from, another place. Michigan, New Jersey, California, Arizona, Maryland, Memphis, Tennessee. I think I said Ohio. And then more people is watching from, let's see, Georgia, Texas, South Carolina, Chicago, New Jersey, Savannah, Georgia. Um, the lady that's at the bottom, it would be my left. So over here closer to where you see the state California, Dashina actually passed her registry exam. I don't know if she passed it in October 2025 or September 2025 because I'm trying to keep up with everyone who's passing. So many people is passing and they're coming back to let me know. So if you pass, come back and let me know and I can add you to the shout out board. So shout out to her. She watched my videos for a long time. I don't know how long she watched it for, but she was just rewatching it. I don't know if it was a month, 2 months, or 3 months, but she had watched it for a long time because I had started seeing her comments and I was like, oh, I thought she had taken her test already. So shout out to her and congratulations to her for passing her registry. And Chicago is watching. All right, so that's it for the video. Thank you all so much for watching. Sorry that I've rambled a lot on some personal problems that I've had, but I just wanted to add a story and give context to why I may say disclaimer, this is for educational purposes only, because things can be mislabeled on the internet. And I don't have a radiologist or anyone sending me images and letting me know, hey, you can use this in your video for educational purposes only, and they give me the report, what all these diagnoses is. I don't have that. So I can just only do so much and find my own images until someone, can share that information with me. And so that's why I always say the internet can mislabel things, and I just want to make sure that I'm putting out accurate information for you all. So that's why I gave that story about how someone misdiagnosed me before. But other than that, please if you found this video helpful, please share the video so that we can get a lot of people to pass their registry. I don't have Facebook, X, or used to be called Twitter, Instagram. I don't have TikTok. I don't have any of those. Pretty much because I don't want to. I'm just, I look at my phone all the time. I don't need other sites taking up my free time, pretty much. So, um, anyway, these ladies passed their registry in June of 2025 and May of 2025. They was one of the first ones to come back and leave a comment. But other than that, I appreciate you all for watching. Please give the video a thumbs up. Like I kept saying in the video, I'm recording this at 7 o'clock in the morning. I had really wanted to sleep in. I've been so busy with multiple jobs, multiple shifts, multiple other modalities I teach on the channel. So I've been extremely busy and I really wanted to sleep in, but I felt like if I did, I wouldn't have been able to get the video out for you all. So please share, subscribe. Also leave a comment if you found it to be helpful. Also let me know when your test date is. When is it coming up? How long are you planning on studying for? All right. Thank you all so much for watching and good luck. Bye.